Welcome to the IDF Europe podcast, brought to you by the International Diabetes Federation Europe. In each episode, we explore important topics related to diabetes, from the personal experiences of those living with the condition and healthcare insights, to research, innovation and health policies across Europe. Whether you are living with diabetes, a healthcare professional, or simply interested in learning more, this podcast is for you. In this first episode, we are joined by two incredible guests, Dr. João Raposo, IDF Europe Board Member and Medical Director at the Portuguese Diabetes Association, and Erik Werson, Type 2 Diabetes Advocate from the Netherlands. Together, they will explore what personalisation of care means, why it is important to improve the quality of life of people living with diabetes, and what is needed to implement it effectively. With that, I would like to welcome João and Erik and thank them to be here with us.
My name is Erik. I'm from the Netherlands and was diagnosed with type 2 diabetes in 1998 at the age of 38. So now living with diabetes for 26 years. My life is a busy life that often makes it difficult to incorporate my diabetes in my life. I'm self-employed and mostly having challenging and stressful positions. And alongside, I do a lot of voluntary work. And in my free time, I like to do scuba diving, often with children with a disability. And when I'm not underwater, I like to be in nature and do some hiking.
Nice to be with you, Erik. My name is João Raposo. I'm a medical doctor based in Lisbon, Portugal. I'm an endocrinologist by training. I'm actually, at the moment, I'm a member of the IDF Europe Board. I'm the medical director of the Portuguese Diabetes Association, which is a unique model of a patient diabetes association. And I'm also the board member, the president of the Portuguese Diabetes Society, that's the multidisciplinary professional society for diabetes care here in Portugal. I've been working part of my life dedicated mostly to diabetes care, how to organize care in diabetes, the financial aspects dealing with treatment of diabetes, and most of the time also dealing with what we call the patient education, the patient empowerment, how people might be better involved in managing their condition, because that's the key, in my opinion, to success. And that's why it's important to discuss, because it's always about the interaction between healthcare professionals and people living with the condition and the environment, human and other environment. And so perhaps I think we'll have some points to discuss, Erik.
Yes, I think so.
And the concept is about personalization of care. And so I think that to introduce this discussion, it's what comes to your mind when we speak about this concept. Why do you think it might be or not be relevant for you and for people living with diabetes?
Yeah, good starting point. The first thing that comes in mind is based on my personal experience. It's from about 26 years ago. And the first thing is protocols as a reference only. And that's because of my experience in the initial years of my diabetes. I was treated by a practice nurse, but according to a protocol. And this led to a lot of discussions with my healthcare professional, who always mentioned statistics and the risk that I was subject to. And he tried to treat me according to that risk, minimizing risk, but going about risk and statistics every time. And I tried to follow the step he provided to me, but it led to me being unhappy. Not feeling well. I had to reduce weight to a level that didn't suit me anymore. It wasn't necessary. And also he forgot to celebrate successes. He was busy with his protocol, treating me according to that. And every time we reached a goal, it was immediately a next goal that was set because, statistics say, and it went on and on. But eventually, it led to the opposite that we wanted to reach. So I broke up with him because I couldn't deal with that anymore. And I found other ways to deal with my condition. I listened to my body, managed my blood glucose levels, and discovered that this led to better results than the protocol-based. Because I'm different from a generic type of person, and that's for everyone. Every person is different in many aspects. Everyone's body is different, and that means that you have to incorporate all those aspects in order to discover the optimal treatment. So for me, yes, it's very important that you find a way to personalize care and to make diabetes part of your life and dealing with it in the best way.
Just occurred to me because you were saying that we frequently spoke about the burnout of healthcare professionals, and actually it seemed that you were describing your burnout when you were interacting with your healthcare professional, because when you're just treated like an average person with diabetes that has to follow protocols, it also provokes burnout. Do you think it's a reality? Did you feel that?
Yes, you're right. At a certain point, I really did feel that because I didn't know a way out, and everything I didn't lead to the results that we wanted. And most important is, I didn't feel happy anymore. It cost me too much, and it didn't result in a good quality of life. And he lost that out of out of sight. So that made it very difficult.
And you were also complaining about the feedback. You just had the negative feedback from the healthcare professionals, not the positive feedback. That's important for your quality of life and happiness.
Yeah, and also celebrating the results that you have. If you reach a certain point, celebrate it. And maybe next time you visit your healthcare professional, look at what's next and what you can also do. But finding a way to be happy with your condition instead of only living your condition.
So the personalization of care, it's more than the biomedical hemoglobin A1C, blood pressure, cholesterol levels, and weight. It's linking that to your life and success and happiness.
Exactly.
That's something that we have to discuss more because the healthcare system, it's still not designed for that part.
No, you're right. It's looking at the results, the medical results, but I think it's important that you incorporate every aspect of a person living with diabetes, like lifestyle, cultural background, psychological state, and the biological factors, and find a treatment pathway together. And it's a dynamic pathway because life changes, your body changes, everything changes, and you have to every time find a way to move forward. If you look at a healthcare professional, what do you think is needed to be able to personalize diabetes care? What would be the key elements?
We are always speaking about providing personalized care, individualized care, person-centered healthcare systems. And as we have just demonstrated, that's not what people feel. And so it seems that we are trying to fit people into guidelines, into structured process, not acknowledge that each person is really different from another person. And even the same person will be different in different moments of time because the context changes. And I don't think we are properly trained on acknowledge that, partially because there's a huge pressure from the system that it's supposed to standardize care. So, and then if you add that you spoke about the nurse, I'm a doctor, and now we have dietitians or people dealing with the diet aspect. We have the physical activity professionals. We have in the multidisciplinary team, we have different people involved in the process, and they are all trying to do the person-centered approach. But actually, each one is so confident they know what's the best thing for that person that's in the front of them. They don't provide any room for people express themselves and just say what you have just said about burnout, about that's not good for me, that's you are having a huge negative effect in my happiness and in my quality of life. And so I think most of the evolution in knowledge, and that applies also to technology now in the field of diabetes, actually it's still not helping people to feel more happy and having better quality of life. And that's happening both for people living with diabetes and even for the healthcare professionals in the multidisciplinary team. So, do you think, Erik, that from your perspective, do you feel that dealing with multidisciplinary teams and technology is helping you, or it might be also a barrier?
Good question. Personally, I'm very happy with the CGM that I have because I can't even remember how I managed to take care of my diabetes when I didn't have it, because that insight provides me with the direction of my blood sugar levels and helps me to do the proper action. And I know there's more because we have AI, we have a lot of information, and if we put everything together and we create a different kind of healthcare professional, I think that would be beneficial to every individual person with diabetes. I also recognize what you said is that if you look at healthcare, then there's always a lack of time. There are costs in that you need to make to help people in dealing with their condition, but it must be very effective and short time. But in the end, if you have complications, the cost will be higher. So it may be important to incorporate that into the care that we also provide to people and also the time that healthcare professionals spend with us.
Fully agree with that. When we speak with the different healthcare professionals in different countries, most of them would complain about the time they have to speak with each person living with diabetes. We also have to create that balance between the time and the best use of time, and what activities are we supposed to do during that time. Because when we see normal, let's call normal diabetes consultation, most of us healthcare professionals, we are so in a rush to tell everything that's needed at that consultation that we try to repeat everything again and again and again from consultation to consultation. And that's also something that's so, when we try to record consultations, we just see that people start to see, well, what's your A1C today? Now with technology, let's see your CGM profile. Remember, you are not giving your insulin shots at the right moment. Remember, that has to be some minutes before having the meal. What are you doing as physical activity? Remember to be active. Remember not to eat so many carbs, fast absorbing carbs at that moment. And we try to do in a snapshot a full course of diabetes every time at different consultations. And that's the main reason why healthcare professionals feel they don't have enough time. Of course, time is really important. But again, if it's time to repeat everything again and again and again, that's not helpful for any of the people involved in the process, and that's the waste of resources. I think we have to link that to the training of the healthcare professionals to learn to do what you have just said, Erik, about knowing the context, the perspective of that person that's in front of us, knowing the values, know what are their objectives, their goals in life. And with that, then we can start working on a plan. And the plan doesn't have to be for the next consultation. It's a plan that can be changing, and so we can have immediate goals, some medium-term goals, and some more long-term goals, and that capacity to adapt and to speak and establish that relation between the healthcare professionals and the person that's in front of them. And then we can move on and work in different ways, because technology can help all those lab tests. CGM is fantastic if it's used in the right way, if we adapt that to the life of the people. And that's something that we are still missing.
I agree. And if you look at training for healthcare professionals, is that already part of training of healthcare professionals, or do they have to find it out themselves?
Unfortunately, I don't think that's part of the training. I think we can recognize that nurses have more training to speak with the people living with the condition, with diabetes, as we are discussing now. But I'm much afraid that even that it's losing now, considering what they are, the protocols and the recommendations and the structured approach. We doctors, unfortunately, we are losing that capacity, and we are feeling the pressure just to prescribe the right test, the right medication. And at the end, I think we are losing the most important thing from the health professionals that's exactly dealing with humans. We are humans. We have to value that richness of the human qualities, the recognizing when someone is sad, when someone's happy, to know what makes us move in one direction, even when the other one doesn't agree. I might not agree that you don't want to go out of your house and stay at home because you are feeling sad. But I have to acknowledge that and work with you with that, and just not tell no, you'll have to move out of house and do 10,000 steps each day, and not recognizing that you are not in the right mood for doing that, and work with you. What can we do in the different way? So to answer you, no, I don't think we have the right training at medical nursing or other healthcare professional schools. I think more training and the continuous training is needed. I don't know if you know that, but the World Health Organization has provided a book on therapeutic patient education, and that's something. It's about that. It's about training also the healthcare professionals to acknowledge that part of a normal consultation. That's something that's really needed.
Yeah, I think I know what you mean, because what I missed is some skills that people need to have, like, for example, social workers. And I think that's an important part that need to be included in the training of the healthcare professional, because it's not only the technical things and the things that you do with diabetes, it's more the person behind it. And like you already said, you need to be aware of how the person feels and what he can do, looking at the person behind the face that you have in front of you. So for personalized care, I think that's an important aspect.
The concept of soft skills, because it seems
Yeah.
soft skills are not so important as the other ones. That's the hard ones, the tough ones. When we are dealing with those soft skills, they might be again the pathway to success, because you can provide the best insulin pump, the best treatment, the best pharmacological treatment, and if the other one doesn't accept, doesn't see the relevance, is not part of the decision, then you are just wasting expensive resources.
So the soft skills are important, but nowadays we also have a lot of digital tools like apps, the continuous glucose monitors. How can these be helpful for persons with diabetes? And are they also important and useful for healthcare professionals?
That's a tricky question, I might say, because those are tools, and tools are just that. First of all, we have to be trained how to use tools, so they might be quite intuitive or not, but tools are supposed to be used in a specific context, in a proper way, because otherwise they can provoke damage to any process. Because we know that the evolution of digitalization in health, it's incredible. It's moving in such a fast pace. There's always new ones coming, new updates, new capacities in the system. And so I really think that if we don't integrate those update training in our life, both from the healthcare professionals and for people living with diabetes, they can represent actually a barrier in the system, because at some point, healthcare professional might just say, I gave up. I cannot understand those things. It's always a new one coming to my system. I don't want to know anything more. I keep using the first one that I was trained, because that it solved all my problems. And at some point, we might be having an imbalance between the patient, the people living with diabetes. They are using the last technology platform, and coming to doctors and nurses that are completely outdated in that perspective. And then again, we'll have a barrier in that communication process. But from the healthcare professional, there's still another perspective, because all that technology means that we are having to use in our daily consultations access to platforms, to apps, and they are not usually linked to the systems that we are using in a hospital or in the outpatient clinic. And when we finally have the authorization to use those apps in the system, there's a new one already in place, because it takes a long time to have all the permission circuit in a hospital or in a clinic. And so I think, first of all those platforms and apps, they should be created in conjunction between people living with diabetes and the healthcare professionals, because we are supposed to work together. And usually even the design process is not done in that way. It's usually just one perspective that's incorporated in the system, and then we wait for the others to come and adopt it. And usually that's not a good way to start. And so this represents a facilitation in a process or a barrier. How can we do that in a different way? What do you think about that?
I understand what you mean, because as a person with diabetes, I'm always looking for the best way to deal with my condition. And that also means finding new ways to detect, to get information, and like apps that provide me with the information that I need to deal with my condition. I think that it is a barrier. Maybe some standardization could help, but it goes very quickly and fast, and development can't be stopped. I think we can also move forward in a way that we can collaborate a little bit more with the healthcare professionals, like I did with one of my healthcare professionals who was very interested in the CGM at that time that it was introduced, because she said, I always see the lab results that are point results. Now I can see the graphics over a long time. So please provide them to me, and let's go through it and let's have a look at it together. And I helped her understanding in what she could see in those figures. So there are many different tools, but we can collaborate and help each other in showing results. What am I seeing in my app or my data? And can I provide the healthcare professional with the information he or she needs to help me finding a way to deal with my condition?
And I think even before I was speaking about the design, when we are creating those apps or those platforms, and just to remind us that we are in these IDF Europe podcasts here, and why it's relevant to have this kind of organization merging different opinions, because we can have the perspective of people living with diabetes, even different types of diabetes, different lives involved, different countries, because otherwise we might be again wasting resources, because we have energy, we have the capacity to do much better, but then we waste because we are trying just to see one sole perspective. And that's something that we have to be changing for the future. But one question for you, Erik. So it's how important is your relation with your healthcare professionals, since you are quite able to manage your diabetes? So what do you think is still need from the healthcare professional at this time in your life?
Yeah, that's a good question. First of all, I am responsible for dealing with my condition and integrating it in my life. And I'm very committed in taking that responsibility. That means that I personally need a partner or maybe a buddy that can reflect on my condition, on my actions, that has good knowledge about diabetes care, medication, tools, and everything that's available, and that can also guide me through the best way of treatment, places to find information or additional support. It should be a partner that supports me in my efforts to deal with my condition, accept failures or impediments, find a way around them, and find a way in helping me to improve my condition or my life. So not especially someone that tells me what to do. And I know there are people with diabetes that need that. But for me, it's finding partnership, help me. I'm alone, especially with my type 2 diabetes, because the only person I see is my healthcare professional twice a year. So sometimes I need that reflection with someone that tells me, how are you feeling? What are you doing? And can we find a way to improve your situation? And if it's only someone that knows a lot, that looks at my figures and doesn't tell me anything, sometimes I know more about diabetes than my healthcare professional. So let's make that partnership, and then it has added value.
I think that's the good conclusion of our talk here now. It's about the relevance of that partnership, about sharing decisions, about sharing successes, about sharing failures also, because some points we share also not only success, but we also share some things that we didn't achieve. And if we have that sharing link between both sides here involved, then we are achieving that personalization of care, because we are using the most important thing, that's that linkage between people. That's the things that make us move, the things that make us happier, and the things that bring us the quality of life. And I think that's the end result of this personalization of care that will only be possible when the system is designed in that way.
I agree, Joe. And we have to learn, because it can't be done in one step. We have to learn, have failures, and improve the system and improve the healthcare.
Erik, it was fantastic to speak with you. Thank you.
Yeah, thank you again to Joe. Always nice to speak with you, and I think we could talk about this issue a very long time.
Yeah, for sure.
Thank you, João and Erik, for sharing your insights on such an interesting topic. We look forward to continuing to work together on this topic and making sure that all people living with diabetes have access to personalised care. To our listeners, thank you for joining us on this journey. We hope you find this discussion inspiring. If you have any questions or topics you would like us to explore in the next episodes, please reach out to us or leave a comment. Don't forget to subscribe to the IDF Europe podcast so you don't miss our upcoming episodes, where we'll continue to explore important issues related to diabetes.